one is a distraction. Okay, so we're not actually getting there and mobbing. If you guys can remember kind of how the electronon process sits there, if you can kind of remember, it may make sense to you why we just, if we're going to do this mobilization, we typically just do it for distraction. And I do these all supine with a person. There's lots of different ways. You guys have seen this already. There's lots of different ways to do the mobilization, but this is just the way that I do it. This mobilization can help with flexion and extension. It's kind of a catch-all mode, right? Okay. So this table height should work. The main thing, remember, ulnohumeral. So when I'm trying to do it, I have to block the humerus. Now there's different ways to do this. I think in the book they use some sort of belt to strap it down, and then they can use their hands here. That is one way. I've also seen people block it off here with their hands and then use a belt and wrap it around their waist and come back this way. The way I do it, and it's probably a little bit more work, so I'd maybe recommend trying those others if you want to sometime. But I just block the humerus right here with my hand. I try not to cut off blood circulation, so I may ask the patient about it. Is that comfortable enough? Then I just get my hand in here. I try to wrap it around where I think the ulna is. I'm getting close. I'm getting proximal. I'm not way out here. I'm right up near the joint, getting a grip here. And then I'm trying to just essentially lean back. So I'm trying to get a good stance here and just kind of lean my body back, shifting my weight to my back. Do you feel some traction there? Oh, yeah. So sometimes you have to play with it a little bit. I'm going to kind of get a little closer to the joint here and shift my weight back. So that's this joint mode. So this isn't, with any of these mobilizations, if you're doing a mob, a lot of times you may be there for a sustained period of time. So watch your body mechanics. Raise the table to appropriate height. Don't bend over in here. Try not to use as much this motion. As I said, with this one, the way I'm doing it, it's a lot of times you're going to use this motion some. There are probably some better ways to do it, but I don't have belts with me right now, and I haven't done those as much, so I'll teach you guys this way. But
in their direction,
yeah,
just grab an aid, have the aid pin it down. So I tell you a belt or have an aid come help you. Now you're going to be bosses of the aid.
Yeah, throw them in there. Get them to pin it down, and then you can get that force. So once again...
like cats, you know, and you don't feel like you have this, you know...
Thanks, Ron. I've been working out. I've been working out.
She already has the
You're working on a big guy like John or something, you know, get Heather in there to sit on John's shoes.
Sit on you.
Sit on where?
So with the ulnohumeral, remembering that open pack position is more comfortable, so somewhere in around 70 degrees of elbow flexion here. So if I'm out here, it may not be as comfortable, and it's harder for me. I typically just do it here because it would be harder for me to get that distraction from this point. So once again, blocking with the other hand on the humerus, getting in here proximal on the ulna, shifting my body weight backwards so I get that distraction. You feel that? A lot of times it's patient comfort that's going to guide how much you're doing and how long you're doing it for. Okay, so let's just start out working on that one.